Biomechanics of post and core. Welcome everybody to this presentation of today's topic, biomechanics of post and core in dentistry. Today we will discuss the biomechanical aspects of post and core restoration in endodontically treated teeth. Endodontic treatment, while necessary, alters the tooth structure and function. Successful restoration depends on understanding these changes and making informed clinical decisions. We'll focus on factors like post selections, material choice, and how these affect the tooth's longevity. This presentation will cover the core biomechanical principles involved in restoring these compromised teeth. The marvel of biomechanical engineering, designed to withstand significant forces. When teeth are compromised by caries of trauma, endodontic treatment is often required. However, this process can lead to changes in dentin properties, often described as brittleness. To restore these teeth effectively, we must prioritize adhesive techniques that create an integrated restoration. Fiber post with their elastic modulus similar to dentin offer a superior option for even stress distribution. Dentin alteration. Dentin is a complex structure that plays a crucial role in stress distribution. Endodontic procedures, particularly the use of irrigants like sodium hypochlorite and EDTA or ETA, can alter its mechanical properties. Studies have shown changes in micro hardness and flexural strength. Therefore, meticulous irrigation and complete removal of irrigants are critical to successful bonding and long-term restoration success. Effects of endodontic files. Nickel titanium files enhance efficiency, but can induce dentinal defects and micro cracks. Rotatory versus reciprocating motion, conflicting research. File design and alloy, such as M-wire, gold wire, blue wire, influence stress. SAF system minimize stress, as we see in the picture, the blue line, and retreatment increase risk of defect. Mechanical effect of endodontic files. The self-adjusting file system, OSAF, minimizes stress concentration. Retreatment further increases the risk of defects, emphasizing the need for precision and care during instrumentation. Restorative material and tooth integrity. The goal of restoration is to recover the tooth's biomechanical function. Composite resin is the preferred material, while amalgam is discouraged. Proper bonding and light covering techniques are essential for successful restoration. Bulk fill composite and glass ionomer bases can enhance stress distribution. Proper light covering is vital, and dual cure cement are recommended when using fiber post. Fiber post selection and biomechanics. Fiber posts are favored over metal posts due to their similar elastic modulus to dentin. Key factors in their selection and performance include post design, length, diameter, and the ferrule effect. A sufficient ferrule, ideally 1.5 to 2 millimeters, is important for stress distribution and fracture resistance. Relining post with composite can improve heat in flared canals. Understanding these factors is essential for optimal clinical outcomes. The ferrule effect is very important. These pictures just show that this post B, smooth fiberglass post, demonstrating perfect integrity of the fibers along the entire post. And this picture shows us that the A, clinical picture of caries affected molar tooth, here, this part, majorly, and B, corresponding patient-specific finite element models. C, modified von Mises stress concentration on occlusal enamel without dental support, and also on the pulp floor, the stress level with the red colors on these areas. It's as we see for the A, flared root canal prepared to receive a fiber post. But here, B, the shape and diameter of the post hole is non-uniform, resulting in a mismatch between the fiber and the post and the root canal walls. For the C, relining procedure with composite resin. D, significant volume of composite covering the fiber post. And E, final direct composite restoration in absence of the post relining. All this volume will be filled with resin cement during the cementation procedure. And this one we see that the role of Frole is important because this red color show us that there is no enough or sufficient Frole, which the core will put more stress over here over this part, which potentially could lead to fracture over time if this part exposed to force and so on. For the clinical performance of endodontic, we understand that clinical studies consistently show higher failure rates in endodontically treated teeth compared to vital teeth. Factors like restorative material, cusp coverage, and direct versus indirect restoration influence performance. Clinical evidence is important for validating laboratory findings and guiding clinical practice. And you should also think about the diameter of the post. It must be 1/3 of the diameter of the tooth, and so on. 4 mm shortened apically, and Frole must be around 2 mm. The post length must be at least equal to the crown or a bit longer, and so on. This picture from 1984 studies show that during a period of 25 years observation, they found out the failure rate for different material. This here we see a 40% of failure of this post, 3 dead post out of 5. And in summary, I would say that endodontic treatment significantly altered tooth biomechanics. Proper restoration requires meticulous technique and material selection. Fiber post and adhesive techniques are crucial for long-term success. Frole is very important. Clinical studies are essential to validate laboratory findings. And that was all for today. Thank you for your attention. And here are the references we were using this presentation. Thank you and stay safe.